ओंटारियो ਵਿੱਚ 1400 ਤੋਂ ਵੱਧ ਨਵੇਂ ਕੋਵਿਡ-19 ਕੇਸ ਤੇ 5 ਹੋਰ ਵਾਇਰਸ ਨਾਲ ਸੰਬੰਧਿਤ ਮੌਤਾਂ ਦੀ ਰਿਪੋਰਟ ਕੀਤੀ ਗਈ ਹੈ। ਟੈਸਟ ਸੰਕਰਮਤਾ ਦਰ ਲਗਭਗ 7 ਮਹੀਨਿਆਂ ਵਿੱਚ ਉੱਚ ਪੱਧਰ ਤੇ ਪਹੁੰਚ ਗਈ ਹੈ। ਵਧ ਰਹੇ ਕੇਸਾਂ ਦੀ ਗਿਣਤੀ ਦੇ ਨਾਲ 7 ਦਿਨਾਂ ਦੀ ਰੋਲਿੰਗ ਔਸਤ ਵਧਦੀ ਜਾ ਰਹੀ ਹੈ ਤੇ ਅੱਜ 1400 ਤੱਕ ਪਹੁੰਚ ਗਈ ਹੈ, ਜੋ ਇੱਕ ਹਫ਼ਤੇ ਪਹਿਲਾਂ 975 ਸੀ। ओंटारियो ਦੇ ਮੁੱਖ ਪਬਲਿਕ ਹੈਲਥ ਅਫਸਰ ਡਾਕਟਰ ਕਿਰਨ ਮੋਰ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਸੂਬੇ ਅੰਦਰ ਵਧ ਰਹੇ ਓਮਿਕਰੋਨ ਦੇ ਖਤਰੇ ਨੂੰ ਧਿਆਨ ਵਿੱਚ ਰੱਖਦੇ ਹੋਏ ਸੂਬੇ ਵਿੱਚ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਹੋਮ ਤੇ ਰਿਟਾਇਰਮੈਂਟ ਹੋਮ ਲਈ ਪਾਬੰਦੀਆਂ ਨੂੰ ਸਖਤ ਕੀਤਾ ਜਾ ਰਿਹਾ ਹੈ।
Today we are reporting an additional 1,429 cases of COVID-19, and our provincial weekly case incidence rate is 56.4 cases per 100,000 people. Ontario's percent test positivity has been steadily increasing and is currently at 6.6%. Hospitalizations have increased by 13% in the past week, and while ICU occupancy remains stable, the expected impact of Omicron on hospitalizations in ICU is not yet observed. While there is still some uncertainty around the virulence of Omicron, we have good evidence that it is more transmissible than the Delta variant, and it is spreading amongst fully vaccinated individuals. Data suggests that each Omicron case is infecting 4 to 8 times more individuals than the Delta variant, and it is rapidly becoming the dominant strain in Ontario. This means even if it is less severe with so many people infected, there may be significant demands on the healthcare system. This also means that we must take steps to protect our most vulnerable, including putting in place enhanced measures to limit the spread of COVID-19 and protect long-term care residents, staff, and caregivers. Notably, all general visitors will need to be fully vaccinated to enter a long-term care home, as well caregivers, unless they have a valid medical exemption or they are visiting residents in palliative end-of-life situations. We will also be requiring the testing of staff, students, volunteers, and caregivers, regardless of vaccination status, at least twice a week prior to entry into the home. A negative test will also be required upon entry to a long-term care home for all visitors and support workers who provide essential services to a resident or to the facility unless they have a negative test the day before. Additional restrictions with respect to the number of visitors per resident, as well as cohorting for high-risk activities, will also be implemented, and we are directing long-term care homes to increase infection and prevention control audits.